Girdle, clavicle and sternum joins by the sternocostal joint. The coracoid process is here. Subscapular fossa is here. The glenoid cavity is here. The spine is here. The acromion is here. The coracoid process is joined by the acromyoclavicular joint. The subscapular fossa and glenoid cavity are joined by the shoulder joint. The spine is by the acromyoclavicular joint. The supraspina fossa is here. The infraspinous fossa is here. And they are joined by the spine and the acromion by the acromyoclavicular joint. The sternoclavicular joint is here. It articulates with the sternum and the clavicle. The acromyoclavicular joint is here. The humerus. Humerus head is attached to the shoulder joint. Glenohumeral shoulder joint articulates with the scapula and the humerus. The greater tubercle is here, lesser tubercle is here, and that is joined by the shoulder joint as well. The deltoid tuberosity is here, and that is joined by both the elbow and the shoulder joint. The medial condyle is here. The coronoid fossa, which allows corresponding processes of the ulna to move, is in here, and this is the trochlea here. The capitulum is here, and it articulates with the ulna and the radius. The ulna is here. The olecranon is here. The coronoid process is here. The styloid process is here. The radius is here. The head of the radius is here. The radial tuberosity is here. The styloid process is here. The olecranon is the elbow joint. It articulates with the ulna and radius. The coronoid process is proximal radial ulnar, and it articulates with the radius and ulnar. Styloid process is bottom of radius, and it joins with the wrist joint, articulates with the radius and proximal carpals. The radius joins with the wrist joint, and it articulates with the radius and proximal carpals. The head of the radius is here. It joins with the elbow joint and articulates the radius and humerus. The radial tuberosity joins with the elbow joint and the wrist joint and articulates with the radius and humerus. The styloid process joins with the wrist joint, articulates with the radius and proximal carpals. For the carpus, this skeleton does not show all the individual bones correctly due to this probably right here. But here we go. For the proximal row, it is the scaphoid, the lunate, from lateral to medial, the scaphoid, the lunate, the triquetral, pisiform, joins by the wrist joint. The distal row from lateral to medial is the trapezium, trapezoid, capitate, hamate, and it is joined by the intercarpal joint, and it articulates with the adjacent carpals. The ulna, radius, scaphoid, lunate, triquetrum, and pisiform form the wrist, which is articulated with the wrist joint. The pollex is the thumb, and it forms the joint carpometacarpal of digit 1. The phalanges have distal, middle, and proximal, followed by the metacarpals head, shaft, and base. The pelvic girdle, the ilium, the ischium, and the pubis fuse together here, and the point of fusion is through here where the femoral ball lies. The coxal bone is joined by the sacroiliac joint, which articulates with the sacrum back here and the coxal bone. The acetabulum is where the hip joint goes in for the femur, and it articulates with the hip bone and the femur. The pubic symphysis is here. It articulates with the pubic bones. The obturator foramen is here, and there's no joint directly, but if I had to pick one, it would be the sacroiliac joint. The iliac crest is here, and that is joined by the sacroiliac joint and articulates with the sacrum and coxal bone. The anterior iliac spine is here. The iliac fossa is here. The lesser sciatic notch is here. The ischial spine is here, and that all of those go with the sacroiliac joint, articulates with the sacrum and coxal bone. The ischial spine articulates with the hip joint and with the hip bone and femur connected with the hip joint. The ischial tuberosity is here. The femur. The femur head is here. The greater trochanter is here. Lesser trochanter is here. The adductor trochanter is here. The greater trochanter is joined by the hip joint and articulates with the hip bone and femur. Same thing with the lesser trochanter. The adductor trochanter is the knee and tibiofemoral joint and articulates with the femur and the tibia. The medial condyle is here, and that is joined with the femoral patellar joint, articulates the femur and the tibia patella. The lateral epicondyle is here. The medial and lateral condyles are here. And the same thing, it joins with the femoral patellar joint, articulates with the femur, tibia, and patella. The patella is here, and it's on top of both the femoral patellar and tibiofemoral, and articulates to the femur and the tibia patella. The tibia is here. The fibula is here. The tibia medial and lateral condyles are here, and it connects to the femur bone. The superior tibiofibular joint articulates with the tibia fibula proximally. The tibial tuberosity is here. The medial malleolus is here, and that forms the ankle joint, articulates with the tibia and fibula. The proximal and distal tibiofibular joints are inferior tibiofibular joints. The fibula distally and superior proximally. The fibula is here. The head is superior tibiofibular joint, articulates with the tibia, fibula proximally. The lateral malleolus is here. That is the ankle joint, articulates with the tibia, fibula with the talus. The tarsus is here. The talus is underneath here, and that connects the foot to the tibia. That articulates with the tibia and fibula superiorly. The calcaneus, which is here, and that is connected by the ankle joint indirectly and articulates with the tibia and fibula with the talus. The cuboid is here. The navicular is here. The medial, intermediate, and lateral cuneiform bones. Same thing as with the carpals. There's not enough bones pictured here to point out them correctly. But the medial, intermediate, and lateral cuneiform bones. Medial cuneiform bone joins with the tarsal-metatarsal joint, articulates with the tarsals, metatarsals, and proximal phalanx. The intermediate cuneiform and lateral bones, intertarsal joint, articulates with the adjacent tarsals. The metatarsus joins with the tarsal-metatarsal joint, articulates with the tarsals and metatarsals. The phalanges join with the metatarsal phalangeal joint and articulates with the metatarsals and proximal phalanges. The greater toe, which is the hallux, joins with the interphalangeal joint, articulates with the adjacent phalanges.